Sure. Thanks, Minister and Premier. So 363 new cases today in Victoria. We are on a bit of a numbers roller coaster at the moment, but with no absolutely clear sign that numbers are decreasing. I hope the trend moves in that direction. But the recommendation on masks is really because it's one of those, again, low cost, relatively easy, small imposts that can make a real difference in transmission. And when we know that there are essential reasons to go out, it is one of those additional things that can protect both ourselves and those around us from transmission from coronavirus. It is a new norm. We'll have to get used to new behaviours, but I think Victorians have done really exceptionally well with all of the new habits that we've had to take on over the last 5 or 6 months. Whether it's the spacing that we find ourselves standing on in supermarkets or cafes, the distance we make when we're passing someone in the street, the hand washing, the excluding ourselves when unwell, and going for testing even with just a runny nose. We've really stepped up, and I think we'll step up with regard to masks as well. It is a recommendation for everyone over the age of 12. That is in recognition that it's likely to work for all of those age groups. Below the age of 12, it's a consideration. We say not for toddlers, so not 2 years and below, but it's a consideration for all other children. But it is mandatory really from that high school age onwards. We don't want kids to be some of them to be enforced to be wearing them in primary school and others not to be. So it really is just for those 12-year-olds in high school and above, and for all of those other reasons when we're leaving home. For people with medical conditions, there'll be exemptions. For other people who for one reason or another cannot wear them, there'll be exemptions. And obviously when you're engaged in activities where it's entirely impractical to wear them, then that's not a requirement. But it does make a difference. And having universal mask wearing is the key here, because not only are you, if you're potentially infected, shedding less virus into the atmosphere, but the person around you, if they're 1.5 metres away or closer or further away, will be less exposed. And if there's virus out there in the atmosphere, there's some filtering that happens with those cloth masks. And as we say, it doesn't have to be a mask. It's a cloth face covering. It does need to cover the nose and mouth. And as some of you might have seen, masks don't do very well in your pocket. They don't do very well when they're sitting on your chin. They do need to cover your nose and mouth to work properly. So that really needs to be reinforced. But I am very confident that we'll take this up as a new behaviour in Victoria, and that it will make a significant difference. We do have these settings that amplify transmission. We're addressing transmission within and between homes with the stay-at-home directions, but for all the reasons that people need to go to work, this is one of those additional measures that will help, because workplace settings, sometimes with very large workforces who have to be in closer proximity, they can amplify the transmission. We know that meat works are an issue. We know that aged care, healthcare settings are an issue. Distribution centres with sometimes very large workforces can be a real amplifier of transmission. So they're all the kind of settings where staff are going to be wearing masks from now on in, and for it to be mandated. In terms of outbreaks at the moment, we have seen 3 additional outbreaks in aged care. There will be the full details in the Cho media release this afternoon. We've also seen single cases in some youth justice and Melbourne Remand Centre settings. So for 2 individuals in Melbourne Remand and Youth Justice, they have been diagnosed with coronavirus, both isolated. Doesn't seem to be a risk to anyone else. There is a normal process of quarantine for new entries into remand or prison, which protects the wider prison population, and that's working very well. There is a third setting with a teacher who's tested positive, and that will involve some contact tracing, because although physical distancing was present, we do need to follow up all the potential close contacts amongst that population.
take any questions yet.
And the changes to the masks, has that come about because the recent research that's showing that this virus is more airborne than we thought it would be, that it transmits such?
I know there's always been controversy about whether it's just droplet spread or whether there might be airborne spread with this virus. I think the key evidence that's come out recently is that regardless of our assumptions about transmission, wearing a mask makes a practical difference. So just following people who wear masks and the settings in which masks are worn has shown that there's a really significant 2/3 or more reduction in transmission. There might be circumstances where instead of droplet spread up to 1.5 metres that the virus can carry further. But the practical effect of masks is that no matter what the transmission is, it reduces the load that gets out between people, and even imperfectly made, those masks make a significant difference.
What's the advice on face shields?
Well, face shields do have a benefit. They work not dissimilarly to masks in terms of reducing the transmission between people, and they can have significant benefits for individuals who need their facial expressions to be seen. I'm aware that children with autism often take clues from facial expressions, and so there might be settings where a face shield has some benefits, obviously the protective element, but also the communication benefits are apparent.
Would you prefer one or the other, or would you prefer masks?
No, really, masks are our recommendation across the board for the community. I think there are some specific settings where a face shield is a consideration. That includes in some healthcare settings as well as an additional protection, but it's not a routine recommendation for the community.
And in a workplace where people can distance by 1.5, but there's multiple people at the workplace, do you still recommend that mask?
Yeah, we do. I think one of the things about the 1.5 metre distance is it's not perfect. We know that there's a benefit in making that distance even greater. There's still a reduction in transmission out to 2.5, 3 metres. And we also know that we go into a setting thinking I'll stay 1.5 metres from everyone, but there are moments where people come within that distance, and so really in indoor settings it's a better habit to have that mask on all of the time for all of those occasions when you might come closer to someone else than 1.5 metres.
The $200 fine is considerably less than other social distancing fines. Do you actually think that that's going to be enough to deter people?
I do. I think Victorians have done a brilliant job in getting these new behaviours into place. I think they'll see the benefit. I think it'll be understood to be relatively easy, and I think it'll become one of those habits where we look around, everyone else will be wearing a mask, and there'll be some social pressure to do the same.
Was that part of the thinking that Victorians have adopted it really well over the last, I can't even remember when it was introduced, week or so, that you sort of wanted to see how that would play out, and then what were some of the discussions about this phase of introducing the masks as compulsory?
Oh, certainly we made it as a recommendation, but with numbers not decreasing rapidly, and with a real need for that to be the case, and with a small additional impost, to be able to get us to our target earlier, whether it's zero transmission or whether it's just getting down to single figures, we want to do that in as fast a time as possible, and mandating is just one of those additional pushes that'll get it to kind of universal coverage much faster.
Just with schools, practically speaking, is that the expectation from when they leave home to when they get home, that the kids will be wearing a mask, and how do you manage meal breaks and those sorts of things?
So obviously if you're drinking, if you're eating, you're not going to be wearing the mask, but yes, for the rest of the time the expectation is that mask is worn. These won't always be really easy, and they won't always be welcome, but they are important, and there are lessons increasingly internationally about the jurisdictions that are doing well have introduced mandatory mask wearing, and those that haven't are the ones that are seeing really catastrophic numbers at the moment.
From when the first recommendation was made, we saw masks sell out pretty quickly. No doubt from today we're going to see that again. Are you confident that there's going to be a supply, and should maybe the general population be looking to use those homemade options or the scarves rather than trying to get that medical grade coverage that
Yeah, I think people shouldn't stress or become anxious about not being able to access one in terms of a purchased one, because there are opportunities to make one at home. We've got instructions on our website. There are many other websites that show you how you can make a homemade mask, and what we're talking about is a face covering that covers the nose and mouth. And so I think almost every household will have an option to do something akin to that. So people shouldn't fret about not being able to get a tailored mask or one that's a medical grade or akin to that. They just need to find a face covering and be able to wear it from Wednesday onwards.
And once you have one, we've seen doctors advising that you can't touch the front of it. You need to wash your hands before you put it on, after you take it off. What's the sort of, I suppose, general advice that people should be following when it comes to that?
Yeah, the general advice is to wash your hands before and after with soap and water or with an alcohol-based hand rub, to not touch it as much as you can avoid it, and when taking it off, not to touch the front of the mask as well. It's also, obviously, as a cloth mask, it's also useful to have a few and to clean them. I put mine on the hydronic heating this morning to clean one so that I could have another one ready for today, and just to rotate them through so that you've got a clean one each and every day.
Professor, the AMA described the number on Friday as catastrophic. Yesterday it went back down, but today it's a pretty concerning number. How concerned are you that there's no pattern back down? Yeah, it is concerning. That's why one of these issues about implementing masks is we're not going to wait for numbers to decrease. This is something that we should be doing now, regardless. And the 2-week period from the stage 3 restrictions hasn't come yet, and so I think there's still an opportunity to see those numbers drop. But in a sense, these settings that amplify transmission are our new target. And I think we are addressing transmission between homes and within homes, but we have a new target here, and a lot of the new numbers today will be related to those settings that we're now trying to get on top of with a new intervention.
So it's more specific rather than...
Although those stage 3 restrictions didn't apply to Metropolitan Melbourne and Mitchell Shire, until 10 days ago, those hotspot local government areas and postcodes have been in stage 3 restrictions for 3 weeks now. So is it, and they're still considered hotspot suburbs, so what's still driving the transmission there?
So certainly those initial hotspot postcodes that have been under a lockdown for a longer period of time still have not insignificant numbers. Part of it is when you get a spill of significant transmission in the general population, that then it's taken to those workplaces, and then it's transmitting for those essential reasons to leave home, because there's just more people who are positive with coronavirus. This is where masks will play a role. We have seen some stabilisation in a number of those postcodes, but they have had big case numbers. So it's a mixed bag. Overarching restrictions that apply to Melbourne and Mitchell Shire, I think, are pretty robust and will make a difference. But we have to do everything. We have to pull out every tool as required in order to get on top.
So even at the end of the 2-week period for the stage 3 restrictions for all of Metropolitan Melbourne, we might not see cases come down?
We have to be ready. We have to be ready for whatever. If we see that there's a drive in transmission in a new setting, in a new cohort of people with a new challenge, we'll need to respond to it. Again, based on the data, based on the epidemiology. I'm not being complacent about the fact that we've done enough. We need to watch those numbers, and we need to think about whatever else is required on the basis of that day-to-day review.
So the measures in aged care and the wearing of masks is basically at the moment an alternative to moving to sort of metropolitan-wide stage 4 restrictions? I
wouldn't call wearing a mask as an alternative. I'd call it a really important additional measure. It is something that can potentially avoid needing to go to different restrictions. So we should do it. It's going to be a benefit, but we shouldn't regard it necessarily as sufficient.
So how close are you to pulling the trigger on stage 4?
Well, we don't know. We have days to watch. We've got this new intervention. We've got a daily review of settings and transmission that we need to reflect on.
Professor, you've talked about the precautionary principle a lot.
Why weren't masks thought of as a precautionary venture earlier than this?
Well, certainly the national recommendation was that they weren't recommended. We were following that national recommendation with very low levels of transmission. We went through our entire first wave without universal mask usage or mandatory wearing of masks. I think there are a couple of things. One, reflecting on this wave as significantly more challenging, different populations involved, more community transmission, and numbers ticking up. And when the transmission reached a level that we saw was going to challenge us, I was keen to make that recommendation to the Premier and to Cabinet. There was some time to develop the communication materials and to make sure that we had the policy and the all of the supporting information available. But I hope that it's full guns blazing now.
So when did you take it to the Premier?
Oh, I can't remember the exact date. I can't. It was about a week before the formal announcement, as we were working up all of the communication materials.
Considering that toddlers can't wear masks, where are we in the childcare situation?
Yeah, so it's not a requirement in childcare. We've seen very, very few cases in childcare. Childcare hasn't closed anywhere in the world that I'm aware of, even as primary school and high schools have closed at one point, involving more than 90% of students. Childcare doesn't seem to be a place that either drives transmission or that we should be concerned about in terms of significant illness.
Will masks be mandatory for childcare workers?
No.
The 3 deaths overnight, were they in metropolitan Melbourne, regional Victoria?
They were in metropolitan Melbourne.
Aged care?
2 were in aged care.
And one was?
Another setting.
Okay.
Yeah.
Do you have the genders and ages? Sorry?
I think they were all in their 90s.
2 men and 1 woman.
How many aged care facilities are infected?
Oh, that'll be in the Chief Health Officer update this afternoon, but 3 additional today.
That'll be around 50.
Yeah, it would be.
Professor, given today's number, that's another big burden in contact tracers. How comfortable are you at the moment with, I guess, the time between these cases being identified and then the time to actually identify those close contacts?
Yeah, very happy. We got through the 420 day on the same day, where we got through all of those cases yesterday. We'll get through all of today's cases. I'm aware that there are some contacts who needed to be manually entered into a database so that we could have the automated notification to close contacts, but those close contacts were notified by phone anyway. But there are some manual processes, in part because we're getting the assistance of our interstate colleagues, and we don't have a single interoperable IT system across all jurisdictions. We're needing to task some of those interviews to our interstate colleagues and get them back, and then have manual data entry for them.
What's the ref number at the moment?
It's close to 1. We haven't calculated in the last couple of days, but it was pretty much sitting on 1 a couple of days ago. But there are different assumptions that go into models. Some of them have the ref sitting just above 1. Some of them have it sitting at 1. Again, I won't sit back and relax even if the ref is calculated at below 1. We need to watch the numbers to see what's actually happening.
Just to clarify on the mask point before, you said that you recommended that they be mandatory a week ago, but it took a week.
No, I recommended that we should have a recommendation for masks early on, and then that recommendation came with all of the communication materials when they were developed.
So when did you actually tell the Premier that you'd like them to make the amendment?
I can't remember the date.